here in Nova Scotia, we're really just embarking on this journey of improving the food environments in recreation and sports settings. So I've really enjoyed hearing the presentation so far, and I feel like we have much to learn from the experiences encountered in Alberta and BC. Just want to go to the next slide. I'll just start by giving you an overview of what I'll talk about today in just a short 10-minute presentation. First, I'll just give you an outline. I wanted to start by saying that Sarah Kirk has led or been involved in much of the work I'll present today. She was a co-investigator on the Enact project, which I'll talk about first. And then she and I and a number of other co-investigators developed the time study, which I'll discuss next. After I discuss the time study and where we are in terms of that work, I'll describe the linkages we've made with the work of the Nova Scotia Healthy Eating and Recreation and Sports Settings Committee, fondly known as the HERS Committee, and the path ahead for Nova Scotia in implementing healthy eating guidelines, whilst also learning from the experiences described by PJ and Dana. Okay, so why recreation and sports settings? Although PJ and Dana have provided ample reason to modify food environments in recreation and sports settings, I just wanted to share with you the path that led us to be interested in this area. A few years ago, we conducted the Enact study. Enact stands for Environment, Nutrition, and Activity. It was a larger mixed method study looking at linkages between the built environment and youth obesity. As part of this study, we interviewed families about the decision-making process behind physical activity and nutritional choices. Go to the next slide. Some key findings from those interviews were as follows. Parents and youth reported being overscheduled in ways that limited options for healthy meal preparation. Parents reported that having children involved in sport created enormous time pressures. For instance, one family with 2 children involved in hockey reported that they might have 6 games to attend in the run of a weekend. And unfortunately, one way that they had found to save time was either to pick up food on the way to a practice by visiting a drive-through or to eat at the facility itself. So essentially, when forced to prioritize 2 health behaviors, physical activity and healthy eating, these families were sacrificing the latter for the former and placing greater importance on the demands of scheduled physical activities. This work was published in Health Promotion International and featured recently on Arya Sharma's Obesity Notes blog, and that's why there's a screenshot there of his feature on it. Okay, this slide actually borrowed from Sarah Kirk, who took this photo at her child's soccer practice. So here you can see the fast food products in each of the lawn chairs. I think there's a Wendy's cup and I don't know, some other maybe a McDonald's cup on the next chair, showing exactly this pattern of picking up something convenient to eat along the way to sport, and convenient, usually equaling not so healthy. So although there's a popular perception that when a child is engaged in physical activity, it's okay for them to indulge in energy-dense snack foods, some of the simple math that Sarah put together earlier suggests that the foods that are provided during sporting events and practices just don't balance out with the amount of energy that kids are expending. So in response to this finding, we developed and proposed the TIME study. TIME stands for Tools, Information, Motivation, and Environment. And the objectives were to design, implement, and evaluate a multi-level intervention aimed at improving family nutrition habits and incorporating a change in the built environment to increase healthy food availability. So the 2 levels, of course, would be the food environment level and the family level. And the food environment level is, of course, recreation facilities. And here we propose to make changes to the availability of healthy foods served in recreation facilities where children take part in physical activities. And then at the family level, we designed, actually, a smartphone application to provide information about the availability of healthy food choices and personalized nutrition messaging via smartphone. So we can go to the next slide. So our progress to date on the TIME study essentially is that we've developed and piloted a smartphone application for the individual level intervention. It's currently under review with Apple, so for anyone who's interested in developing an app, you should know that it's a lengthy process, and something that we've learned a lot from. That's for a whole other presentation, I think. But essentially, it is complete and under review, so we haven't been able to actually begin that individual level intervention to date without the application, in hand and downloadable on iTunes. But we have conducted some baseline scans of the 4 facilities that committed to being involved in the time study. And I guess most importantly to our talk today, we've linked this research with ongoing work of the Nova Scotia Healthy Eating and Recreation and Sports Settings Committee. So I'll just go to the next slide. And as I said, we're really just getting started here in Nova Scotia, and this is data that's from 4 multi-purpose facilities within one region of Nova Scotia. So it's certainly not generalizable findings. But I did just want to provide a brief snapshot of the vending products that were available when we first entered these facilities, and it essentially demonstrates the overwhelming room for improvement that exists in this setting. And I think it's consistent with much of the initial data that you would have seen provided by PJ in BC. So as you can see, we only found foods of maximum nutrition within beverage vending. These would, for the most part, be water and 100% fruit juice. I should note that we use the nutrient criteria from the Nova Scotia School Food and Nutrition Policy in order to make these designations. So in terms of the HERS guidelines, the Healthy Eating and Recreation and Sports Settings guidelines, there was a provincial advisory committee struck in 2010. It's been a collaborative process of developing guidelines that utilize the Nova Scotia School Food Nutrition Policy nutrient criteria. The guidelines themselves, they will be voluntary guidelines. That's an important point to make. They're currently in draft form, and there's stakeholder feedback sessions ongoing as we speak, I believe. And ARCH, Applied Research Collaborations for Health, where I work, has partnered with the committee to conduct a baseline scan. So that work is ongoing also at this very moment. So we're doing food environment audits of facilities across the province rather than simply those 4 that I presented data to you on. We're also conducting a survey of stakeholders and then in-depth stakeholder interviews. So just to sum up, I'd like to end by suggesting that I think changing cultural norms and shifting the emphasis from profitability of food provision to health as a priority are the 2 key challenges that we're going to face. We're thankful for the guidance of PJ, Dana, and others who have done such tremendous work in BC and Alberta, and we're quite excited, to boldly, I guess, follow them on the journey that they have embarked upon. And I just finally like to acknowledge multiple sources of funding to Dr. Kirk.